Welcome to the module on guardianship and alternatives. Whether you have encountered guardianship situations in your practice or not, this presentation will prepare you for such discussions with families of patients with intellectual disabilities. In this module, we describe guardianship and other alternatives and their importance. We describe the guardian's role and responsibilities. We list the steps involved in the application, including the assessments and reports physicians complete. We provide tips, tools, and strategies for assessing the need for guardianship. We discuss timing and sensitivity of guardianship conversations with families. We introduce 2 case studies. Finally, we provide quality improvement strategies and ideas to apply in PDSA cycles. Be aware that the content provided in this presentation is for informational purposes only and not for the purpose of providing legal advice. Before you continue, please print the project-developed handout, Guardianship and Alternatives. It recaps important points on this topic and will be a helpful reference during this module and after the training. All adults age 18 years and older have the right to make their own decisions. People who cannot make decisions because of a disability need a guardian. Guardianship is a legal process with medical input, giving another person or persons legal authority over an individual. The individual, called a ward, loses the right to decide for him or herself, and the guardian becomes the decision maker. The guardian's responsibility is to ensure that their ward's needs are met. Guardianship is not automatic, and parents do not become guardians by default. Guardianship is court-appointed. Consider and discuss the concept and potential need for guardianship with families as early as possible. This is best discussed well prior to age 18, ideally starting around ages 14 to 16. At the latest, have a conversation with families by age 17. Beginning early gives families time to understand the process and prepare for it, both by completing assessments and paperwork and by preparing emotionally to involve the legal system in a private concern. This process can be painful because it forces families to recognize that the disability is lifelong and that the patient will not or has not caught up to the general population. It may be helpful to frame guardianship discussions as an opportunity to stay involved with the child's safety and health. Physicians, perhaps in consultation with a disability specialist, help families by discussing the issue of guardianship with them as appropriate and connecting them with information sources to meet their needs. A guardian promotes the interests and well-being of an individual with a disability and protects him or her from abuse, neglect, and exploitation. A guardian can be a family member, friend, an agency, or an institution. The guardian must be over the age of 18 with no convictions for serious crimes. The court gives preference to the capability of the guardian over the relationship and gives consideration to the preference of the person with the disability. A parent is not the assumed guardian. A guardian is a decision maker, not a caregiver, and does not have to live with the ward. The guardian is responsible for ensuring that the ward receives proper care, but does not have to provide the care directly. Here are some responsibilities of a guardian. A guardian should consult with and abide by the wishes of the person with disabilities to the greatest degree possible, while ensuring proper care and supervision. A guardian must fulfill court-mandated reporting requirements, typically to file an annual report. Guardians must obtain court approval for such decisions as intrusive treatment, such as sterilization and withdrawal of life-prolonging treatment, placing the person with disabilities in a residential facility, approving and/or authorizing non-routine expenditures, and other controversial actions. According to the Illinois Guardianship and Advocacy Commission, people use guardianship of the estate when someone, because of his disability, is unable to manage his estate or financial affairs. A guardian of the estate makes decisions about management of the ward's property and finances. It is usually separate only when there is a large estate. Guardianship of the person is used when someone, because of his disability, lacks sufficient understanding or capacity to make or communicate responsible decisions regarding the care of his person. The guardian of the person makes decisions regarding the support care, comfort, health, education, maintenance, and professional services, such as educational, vocational, habilitation, treatment, and medical services, for the ward. The guardian of the person is similar to the typical parental responsibility, with the important difference that the court can vacate guardianship and retains the capacity to oversee all decisions, not just serious neglect or abuse. People can secure both guardianship of the person and guardianship of the estate. Here are two other types of guardianship. The courts award plenary guardianship when the individual's mental, physical, and adaptive limitations necessitate a guardian who has the power to make all important decisions. Plenary guardianship may be used for the person, the estate, or both. Limited guardianship is more common with children, but rare with disabled adults. The court awards it when the person with disabilities can make some, but not all, decisions regarding his or her person and/or estate. Guardianship shall be ordered only to the extent necessitated by the individual's mental, physical, and adaptive limitations. A limited guardian makes only those decisions about personal care and/or finances which the ward cannot make. The court order must specifically list the powers of a limited guardian. The ward retains the power to make all other decisions regarding his or her person or estate. The court may appoint a limited guardian of the person, a limited guardian of the estate, or both. Next, we discuss 5 basic steps to apply for guardianship in many Illinois counties. Families will likely want the advice of legal counsel. 1. Before beginning court proceedings, one must obtain a report certifying that the person is disabled and needs a guardian. A licensed physician completes a form explaining the need for guardianship. The form asks for licensing information, contact information, and a list of other professionals on whom the physician's evaluation relies. A physical examination within 3 months of the report filing is required. The 90-day examination requirement protects people who are only temporarily incapacitated. 2. The person seeking the guardianship files a petition called the Petition for Appointment of Guardian for Disabled Person with the Circuit Court. 3. The person with the disability, guardian, and interested parties receive notice. The person with the disability has the right to contest. If you like, use the links provided to view the examination report, form for physicians, and the example petition. Then view the remaining steps for applying for guardianship on the next slide. Once the physician completes the exam, the applicant files a petition and all parties are notified. The case goes before a judge, as described in Step 4. The final arbiter and final protector of the patient is the court. The court may appoint a guardian at law or a guardian ad litem to independently advise the court concerning the apparent need for guardianship at any point during the process. Finally, if the court awards guardianship, there is an oath of office, the official agreement of the appointee to serve as guardian. For severely impaired people, it may be an easy judgment. For people who are less severely impaired, the judgment can be difficult, and the court typically does not rely on a pediatrician's or family physician's opinion alone. Guardianship removes a person's right to make his or her own decisions. This slide and the next present options for those who are aware that they need help and support for major decisions, but function independently in most situations. These options are not appropriate for people with significant cognitive impairments and generally require some decisional capacity to set up. They may have significant long-term implications for taxes and government benefits. Families considering these alternatives are advised to consult tax and legal experts with experience in these matters. A shared bank account helps a person make decisions about their money. It allows the joint account holder to monitor and control spending. A healthcare proxy makes a decision about a person's healthcare if they become incapacitated in the future. This structure requires decisional capacity to set up. A power of attorney can be specified for property matters or healthcare decisions. It gives legal authority to another person to make decisions on another's behalf. The person must be competent to execute a power of attorney. Here are some additional options that supplement guardianship or in some cases, replace it. These are options for individuals with more significant cognitive challenges. Again, these alternatives may have implications for taxes and government benefits. Families considering these options are advised to consult tax and legal experts with experience in these matters. A trust holds title to property and other assets for the benefit of another. The appointed trustee can only use the assets to assist the beneficiary as directed by the trust provisions. For example, a special needs trust cannot be spent for housing and health care. Such trusts may help beneficiaries avoid losing access to essential government benefits. A representative payee is authorized to receive benefits payments, for example, from Social Security or the Veterans Administration, on behalf of the individual with a disability. The representative payee must use the money to pay for the beneficiary's needs and must adhere to all guidelines and reporting requirements. Social Security sometimes requires that payments be made to a representative payee rather than directly to the beneficiary. For example, if the beneficiary's disability is related to mental illness, intellectual disability, or substance use. Next, we discussed ways to assess the person's decisional capacity. This is not necessarily predicted by IQ score, the fact that the person has a disability, or one's agreement with the person's past decisions. After all, many people make poor health and financial decisions. Two such examples are not wearing a seatbelt, even though failure to do so contributes to fatalities, and gambling, even though it may lead to financial ruin. Guidance provided by the Illinois Guardianship and Advocacy Commission stresses that tests to determine the need for guardianship should focus on the ability of the person to engage in the decision-making process and to properly communicate those decisions once made. For example, assess the person's ability to engage in decisions about where to live and work, how and when to seek medical care or other services, how to care for dependents, and how to manage finances. Review the areas not to focus on in the right column before you continue. Here are some practical questions to assess the person's ability to make and communicate decisions. Does the person understand that a particular decision needs to be made? Does the person understand the options available in the decision? Does the person understand the consequences of each option? Could the person properly inform appropriate parties once they make the decision? Another way to assess the need for guardianship is to examine the person's ability to complete tasks. Someone who can direct his or her own care does not need a guardian. To approach this in a practical sense, start with whether the person can get through a day without input from someone else. Then, how about a week? A month? An illness? Be sure to focus on cognitive abilities, not physical. It is important to remember that the physician provides a medical recommendation concerning the need for guardianship, but the decision is a legal responsibility. Preparation, timing, and sensitivity are key to guardianship discussions with families. It is important to prepare youth for adult life early. In early childhood, teach daily living skills as a complement to academics. In middle childhood, discuss sexuality and teach safety in the community. Also have discussions with parents. What do parents worry about? Their child's judgment, safety, or living situations? This opens up communication and helps parents focus on how they can help their adult child make decisions. Assess and discuss guardianship or other alternatives early in the transition process for youth who may not become independent decision makers as adults. The project-developed handout, Guardianship and Alternatives, is a helpful resource for families facing such decisions. Sensitivity surrounding these discussions is important. Recognize the emotional needs of the parents and those of the patient. Include the patient in discussions as much as possible. For families with financial concerns, resources such as local law schools may help families complete the guardianship process on a pro bono basis. Jane is a 17-year-old woman. She has paraplegia and sickle cell disease, which are the sources of most of her medical problems. Due to early childhood brain infections, She also has intellectual disabilities and hearing impairments. She has attended a program for students with moderate to severe intellectual disabilities. Listen as Jane's aunt describes what Jane can and cannot do.
Jane can spell her name, give her address and phone number. She knows her body parts and can describe her pain by telling what hurts. She is able to dress, to push herself in the wheelchair, and to catheterize. On the flip side, Jane cannot read, tell time, or use the phone. She does not know what her period means, where the urine comes from, or what blood transfusions do. She does not understand why she needs to do pressure relief or why she does not have pain in her feet. She has been enrolled in several observational studies and a treatment study for children with sickle cell anemia.
The court, physician, and family mutually agreed that Jane requires a guardian because she does not understand why she needs specific types of care, cannot access care independently, cognitively, not because of physical disability, cannot weigh alternative care, should she have her gallbladder removed now, should she be in the ICU, and cannot consent to continued enrollment in studies. While Jane's mental incapacity for decision-making is the reason for guardianship, she will benefit further from this arrangement due to her complex, acute, and chronic care needs. Guardianship discussions began early in the transition process. John is a 19-year-old male with spina bifida, asthma, and hydrocephalus. He graduated from high school despite learning disabilities. He briefly attended but failed community college. Listen as John's pediatric care coordinator, who has known John since birth, describes his decision-making and communication capabilities.
John's measured IQ is low normal. He has a history of multiple complications from non-compliance with self-care and medication. He can communicate with physicians, travel, and manage his Social Security income, although he does not pay rent because he lives with his family. He can give his history, explain basic information about his disability, and describe what his medications do. He's able to state the risks of unprotected sex.
Although poor decisions have compromised John's health, it was mutually decided that he does not presently require a guardian. He will, however, continue to benefit from discussing his care with his parent. He may want to consider a healthcare proxy so that a person he trusts and who knows his condition will make healthcare decisions for him if he becomes incapacitated. A likely scenario might be a shunt malfunction requiring acute surgery, which may alter his mental status. It is important to note that there are no age restrictions for petitioning for guardianship. However, parents no longer have the legal authority to make important personal or financial decisions once their child turns 18. For example, if a patient without decisional capacity enters a hospital after turning 18 and refuses treatment, the physician will ask for guardianship papers before following a parent's request to provide treatment. The law presumes the individual is capable of making important decisions, even if he or she is not. The following AIM statement expresses optimal care for this key clinical activity. Discuss the need for guardianship with families of patients 17 years or older who have intellectual disabilities for 100% of all such patients and provide guardianship information sources as needed. The measure for this key clinical activity applies to youth 17 years or older with intellectual disabilities. However, discussions around guardianship should begin much earlier, preferably around the ages of 14 or 16 years. For many practices, the pool of patients with significant intellectual disabilities is small. For this reason, the topic of guardianship is not included as a measurable KCA for maintenance of certification. For practices wishing to do this on their own, use the information provided here to add these questions to the data collection tool. If you are aware of gaps in your practice around discussing the need for guardianship and alternatives, and around providing information sources, here are some potential barriers and improvement ideas to try. There are more ideas in the Barriers and Ideas for Change grid. Refer to your printed copy of the grid as you work through PDSA cycles to test ideas that you and your staff think will work. Here are some excellent resources to share with families to help with their guardianship needs. A special thanks to attorney Veda Dmitrievich from the Chicago Legal Clinic, who reviewed this module for legal accuracy. Here are some helpful websites and help desk resources. Review this guide for more information on confidentiality and guardianship.